Hey, welcome back in. August is National Traffic Safety Awareness Month, and traumatic brain injuries are one of the most common injuries that occur in traffic accidents. Dr. Robert Brunner, Medical Director of Spain Rehab and Distinguished Professor in the UAB Department of Physical Medicine and Rehabilitation, is here to talk about TBIs and that recovery process. Dr. Brunner, good to see you.
Good to see you. Good morning.
So you've been doing this for about 30 years or more, and how we talk about and what we look at certainly has changed in those years, right?
Yeah, it certainly has. You know, back in the day, people would have injuries and they just kind of send them back out, not think too much of it. But you know, technology has improved, resources have improved, and we just become much more aware over time, which is good. And you know, we try to focus on the safety because our goal is in preventing these head injuries and not treating them. But if you do have one, we have state-of-the-art stuff.
So is that one of the first things, since we're talking about that this is National Traffic Safety Awareness Month, is that one of the first things that you look at when a person's involved in an accident like that?
Yeah, so our first goal is prevention, right, since it's safety. And the most common cause being motor vehicle in the younger adult population. The older population, it's kind of falls. So the people I see in the hospital that come there, typically they're impaired in their driving. So alcohol-related things, they drive fast, they're distracted, they don't wear a seatbelt. That's what gets you in the situation we hope to avoid. And then with older people, it's falls, right? We've got hilly, it's stairs, so having handrails, that sort of thing is important. But if you do get into the accident, then we have, you know, UAB, a wonderful resource here to help you out.
Why will some people recover differently than others from a brain injury?
Well, I think it's good to be young. That helps. A lot of it, there are some genetic components that can make one more resistant to injury than others. But a lot of times we don't really know why some recover better than others. That's really not understood well. Some things we're doing research on to understand. But it's all how, you know, one takes care of themselves as well.
So what do you recommend for anybody watching now as we all go through life, whatever age you are?
Yeah, well, it's like I was saying, you know, I think it's really in the prevention side of it. So, you know, if we're driving, you know, take responsibility, don't be impaired, wear your seatbelt, you know, follow traffic safety.
Sometimes you can do all that and somebody else is doing the impaired and you end up in the accident.
And if you end up in the accident, you know, we got a great first responder system in this state. UAB's got a wonderful level of trauma, and where I work at UAB Spain Rehabilitation, we have a whole floor dedicated to recovery for head injury. And then we involve community partners in that recovery too.
In the few seconds we have left, what have you seen over your years in people recovering from maybe that looked like they were not going to recover?
Yeah, that's what I see all the time, right? Oh, they said pull the plug, they're not going to survive, and that sort of thing. What I see is people getting back to work, getting back to driving, getting back to the things that they enjoy. So I think even though you're in severe injury, there's a very positive outcome that you can have.
Would you tell people not to give up and keep asking those questions if you find yourself
Absolutely.
with a loved one? I mean, everybody needs an advocate, right?
Absolutely. Oh, yes. Yeah, that's wonderful. Keep going, keep going. And like I said, there's a lot of stuff in the community to help that out as well.
All right, Dr. Robert Brunner, thank you. It's good to see you.
Appreciate it. Thank you for having me.
All right, we'll be right back.